Good morning and welcome to the Healthcare Federation of Nigeria Annual Conference 2024. This year's conference, themed Bridging the Gap in Healthcare, Public-Private Integration as a Catalyst for Sustainable Growth, holds significant importance as we come together to addressing the pressing issues facing the healthcare sector in Nigeria. Over the next couple of days, we will engage, hopefully, in meaningful discussions, actually action discussions, not just talk. We will share insights and explore innovative solutions aimed at driving positive change and advancing healthcare delivery in our nation.
We know there are gaps in healthcare. We know there are issues. And so we came up with this theme because we know that there is a rift between the public and the private sectors. We want to move beyond public-private partnerships to public-private integration and creating a seamless healthcare system that works for the benefit of all.
Can you imagine if only a quarter of our diasporans with that wealth of expertise that they have, if we can bring all those people back home? But we can't bring them back home if we don't create the opportunity for them to practice what they're accustomed to practicing, where they have learnt those trades in different parts of the world.
This administration is determined to move the healthcare sector from mere consuming sector to be a major contributor to our GDP.
This is not the first time you have been suffering from this pain, but this is the first time you are inviting Controller General of Customs to talk about it.
I think that the healthcare industry is huge, and we are doing everything that we can to support the investment in that sector.
Gombe State 3-4 years running, they're number one in ease of doing business in Nigeria. So you can come establish business in health in whatever kind as a diasporan, you'll be welcome.
What does it take for a diasporan to come back? The first thing is the diasporan must have the passion for Nigeria. Trust me, as a diasporan, I think it's time for us to come back, build our nation together. Thank you very much.
One of the critical areas of this administration is partner engagement. And partner engagement means we need to engage with people who are willing to come and work with us in the state to improve the state health indices and give back from the knowledge, the expertise that they've gained abroad.
That alignment is first of all key, and it must come from both sides. You know, it's one thing for a startup or a relatively, in quote, new organization to desire to work with government. It's another thing for it to happen.
Everything was so well organized with dexterity, precision.
And now we have reached maturity, and now we are unleashing potential for action and for change.
I won't be sounding like a broken record if I say it's been very educative and informative.
It's been wonderful. I think we keep raising the bar, and this year has been really, really phenomenal.